Hello, everyone, and welcome to the AMCI E&M series. We've designed this series to break down the E&M guidelines into manageable, digestible nuggets to ensure that you have the best possible learning experience. We encourage you to watch the playbacks as many times as you need until you fully grasp those guidelines. And if you're seeking CEUs, simply click the link in the description to enroll in our online course. If you didn't know, I'm Mrs. J, the Curriculum Director at AMCI, and I'm absolutely thrilled to be here with you today. Now, let's go ahead and let's take a moment to introduce our fantastic team. And we're going to start with Miss Tamika. She is our Assistant Curriculum Director and Resident QHP. Yes, she is a physician's assistant. Now let's turn our attention to Mr. Sandeep, who is also a lead instructor at AMCI, and he is our resident pharmacist with a master's in pharmacy. And introducing our dedicated AMCI approved interns, Miss Dolly, who holds both CPCA and CCS certifications. And last but not least, Miss Jasmeet, who has an MS and a medical background as a CNA. And with such an incredible team by our side, we are excited to dive into these E&M guidelines together. So without further ado, let's get started on this journey. And this is a 4-part E&M series. Yes, we will discuss in part 1 the AMCI annotation technique called CHUN. We're going to teach you how to CHUN your E&M section. We're also going to learn to code office visits and scoring the medical decision making in part 1. In part 2, we're going to discuss inpatient coding, hospital observation. We're also going to talk about consultations and emergency departments. Part 3, we're going to talk about nursing facility visits, prolonged services, and part 4. This is where we're going to summarize all of it and we're going to test your knowledge. But rest assured, throughout the parts, we will be testing your knowledge. And finally, keep in mind that we will consider the 2023 guidelines and apply them every step of the way. Now, let's get this started. Admission and discharge on the same day, code series 99234 through 99236. Let's take a look at the guidelines. And the guidelines say that this requires a minimum of two encounters on the same day, an initial admission encounter and another encounter, that being the discharge encounter. So I could see how people might think that you need two codes. You don't need two codes. You just need an admission and discharge. Doesn't mean you need two codes, right? So the patient has to have been admitted and discharged on the same day, and the documentation has to specify it. Now, if one encounter occurs, then select a code from 99221 through 99223. What do you mean, Mrs. J? I think the example is going to really be beneficial. So let's go ahead and let's review the CHUN of 99234 through 99236. Here it is. Remember, this is same day, admit and discharge. For 99234, this is hospital, inpatient, or observation care for the evaluation and management of a patient, including admission and discharge on the same day. This is straightforward or low medical decision making. 45 minutes must be met or exceeded. 99235, this is moderate level of medical decision making. 70 minutes must be met or exceeded. And 99236, this is high level of MDM with 85 minutes must be met or exceeded. And for services of 100 minutes or longer, go ahead and use prolonged services code. Now, let's just get to it. Let's go ahead and test our knowledge. And I think it's going to make sense after. All right, so our first scenario will be read by Ms. Jasmeet. All right, Ms. Jasmeet, take it away.
Thank you, Mrs. J. So, coders, of the following codes, which best describes the encounter? A, 99235, B, 99222, C, 99221, and D, 99234. Thomas arrived at the hospital at 5 a.m. via ambulance after falling off a ladder and sustaining loss of consciousness for an unknown length of time. A comprehensive exam was carried out, then the patient was placed on observation status. The patient is now conscious and requires a concoction evaluation. Thomas remained in observation for 8 hours, after which time the physician re-evaluated the patient, advised the patient to see a neurologist for further evaluation and treatment, then discharged the patient. The physician spent a total time of 45 minutes with the patient. Of the following codes, which best describes the encounter? Coders, you have 2 minutes to solve the scenario. Thank you.
All right, your time's up. Thank you so much, Miss Jasmeet. Time's up. Loss of consciousness, a comprehensive exam, 8 hours of observation. Total time of the encounter was 45 minutes. These are our keywords. And your keywords don't have to be exactly like mine. You might say, all right, I'm going to highlight that reevaluated patient. There you go. All right, so the next thing that we need to do, we need to know, I need to revisit these guidelines because the guidelines say that in order for this to be a prolonged services encounter, you need a minimum of 2 encounters. What do you mean? All right. So you need one code for the admission. And in this case, we have one. A comprehensive exam was carried out, right? So there was an admission. Also, one code for the discharge. Then the patient was discharged. As you can see, there was a encounter, that initial patient exam took place and a discharge. So we do have a minimum of 2 encounters. And if you revisit the guidelines, it says it's required 2 or more encounters on the same date, of which one of these encounters is an initial admission encounter, and the other encounter is a discharge encounter. So I think it satisfies it. So our documentation says the total time spent with this patient is 45 minutes. So I'm going to go to the front of my CPT book. I'm going to turn to the charts, and I'm going to locate hospital inpatient or observation care services, including admission and discharge on the same date. And then I'm going to look for, well, we know that a medically appropriate history and/or exam took place. A comprehensive exam was carried out. So I'm going to go right to the bottom and look for my minutes, and it's 45. So I'm going to look up, and it takes me right to 99234. And that's our answer. So how do you feel? You feel good? All right, I do. I feel good. I think that's so much easier. Now we have another scenario. We're going to switch things up just a bit so you can see, have another perspective. Okay, Miss Jasmeet, take it away.
Thank you so much, Ms. J. Which code would best describe this encounter? A 99235, B 99222, C 99221, and D 99234. Thomas was brought to the hospital at 5 a.m. by ambulance following a fall from a ladder, resulting in a loss of consciousness of an unknown duration. Upon admission, the patient was placed under observation for 8 hours, during which the physician monitored and evaluated the patient. After assessing the patient, the physician diagnosed him with a concussion and recommended further evaluation by a neurologist. The physician spent a total of 45 minutes with the patient. Then he was discharged. Which code would best describe this encounter? Thank you.
All right, thank you so much, Miss Jasmeet. This doesn't have a time, because this is very similar to scenario number one. And what I want to do is draw your attention to something. All right, so Thomas, same diagnosis, loss of consciousness, but upon admission, the patient was placed under observation, right in observation. There was no workup. Okay, there was no workup. Then the patient was admitted No, the patient was just taken right to observation, and in observation, the patient was worked up and discharged. And the doctor spent 45 minutes with the patient. And because there was no initial workup and discharge, no initial admission and discharge, then this constitutes one encounter. So we cannot use admit and discharge codes on those same day admit and discharge codes. And we're going to revisit the guideline. It says for patients admitted and discharged at the same encounter, one encounter, see codes 99221, 222, and 223. So right away, we're going to get rid of those admit and discharge codes. And then we're going to go to our code series. So they tell us to go to the initial hospital inpatient or observation care series. And if our total time is 45 minutes, we are going to select 99221 because that's the code for 40 minutes having been met or exceeded. So that is our answer. Now I'm going to let that marinate. And while I'm doing that, I want to review the guidelines for same day admit and discharge. Let's go ahead and summarize. There are only two admit and discharge codes on the same day require a minimum of two encounters, hospital admission and discharge. To use these code series, 992, 34, 55, and 56. If one encounter of admit and discharge, you'll have to select the code from the Hospital Inpatient Observation Initial Visit Code Series 99221 through 99223. Okay, so it's time for us to discuss nursing facilities. Now, these are nursing facility visits, right? And in this guideline series, this applies to nursing visits when the doctor visits the patient in the nursing facility, when the doctor visits the patient in skilled nursing facilities, psychiatric residential treatment centers, and immediate care for facility for intellectual disabilities. And that's new. Now, we have a couple of guidelines that I want to bring to your attention. Principal doctor and other qualified healthcare professional overseeing the patient. And pretty much that is the definition. Whenever you see that language, principal doctor or principal QHP, this could be the admitting physician or QHP. And these are the individuals that oversees the patient's care. I also want to bring to your attention, typically, and I'm saying typically, people who are in nursing facilities often have multiple morbidities and they require intensive management. So you should expect that, especially when you are considering level of service. So you know, if you have to um you know if you have to score the MDM, that's going to be significant. Now, let's look at the guidelines for initial nursing facility care. This is the first visit. So, when you have an admission from another site, such as the ED or office visit, you can report that other site using modifier 25. Also, if the E&M services are carried out at a separate site and the initial nursing is a consultation, the consultation must report subsequent nursing codes. If a patient is discharged from the hospital or observation status, then they are admitted to the nursing facility. Use discharge code 99238 and or 99239. You may code that discharge from the hospital and the admission to the nursing facility. You can code them in the same encounter. Also, if you have a situation where there is an admit and discharge on the same day and there are two encounters, you can use the admit and discharge codes. Initial codes may only be used once per admission. Yes, so you can only do that. And then I have one more guideline. To report the total duration of time discharging a patient from a nursing facility, yes, they have their own discharge codes. So you go ahead and do the following. You're going to, even though I don't think I chunned this. Yes, I did chun it. So we're going to go ahead and move on to chun. Nursing Facility Code Series 99304 through 99316. All right, so this is how we did it. 99304 is initial nursing facility care per day for the evaluation and management of a patient which requires a medically appropriate history and or exam and straightforward or low MDM, and 25 minutes must be met or exceeded. 99305, this is a moderate MDM with 35 minutes must be met or exceeded, and 99306 is high MDM with 45 minutes must be met or exceeded. And you see that parenthetical guideline here for services 60 minutes or longer, go ahead and use prolonged services code 99418. Now, when we go down to the subsequent nursing facility care, this is for straightforward. The 99307 is for straightforward MDM. 10 minutes must be met or exceeded. 99308, this is low level of MDM. 15 minutes must be met or exceeded. 99309, this is moderate MDM with 30 minutes must be met or exceeded. And 99310, high level of MDM with 45 minutes must be met or exceeded. And you see this little note here. This note pertains to skilled nursing visits. All right. So for skilled nursing visits, must have a physician unless the law permits. So make sure that you write skilled nursing visit there. Now I want to show you the CHUN for nursing facility discharge. I spoke in the guidelines about being discharged from the hospital and then being admitted into the nursing facility. But when a patient is discharged from the nursing facility, they have their codes too. And that's 99315. And that code is for 30 minutes or less of total time spent discharging the patient. And 99316, this is more than 30 minutes of total time on the date of the encounter. And I just put 31 minutes or longer. All right. So with that said, I think you're ready to test your knowledge. All right, are you ready? Good, because I'm going to ask Mr. Sandeep and Miss Jasmeet to come to the fore.
Thank you, Ms. J. So, coders, as Ms. J said, are you ready to test your knowledge? I know you all are. So, this is our first scenario on the nursing facility services. So, I would ask Ms. Jasmeet to come on the floor and read the scenario for us. Ms. Jasmeet, you can take it away.
Thank you so much, Mr. Sandeep. Which of the following codes best describe the encounter? A 99239 and 99304, B 99304, C 99316 and 99304 with the modifier 25, D 99234 and 99304 with the modifier 25. A 50-year-old attorney is being discharged from the hospital by Dr. Glass after being diagnosed with early onset dementia, stage 4. The patient has no other known comorbidities, and 45 minutes was spent discharging the patient from the hospital. On the same date, the patient arrived at Sunnybrook Nursing Facility, and doctor carried out a medically appropriate assessment where 25 minutes of total time was spent admitting the patient. Which of the following code or codes best describe the encounter? Coders, you have 2 minutes to solve this scenario. Thank you.
Thank you, Ms. Jasmeet. And coders, that's 2 minutes. And from what I see from in the chat, from your answers, you guys are nailing these E&M scenarios and the guidelines as well. So let's go ahead and let's look the keywords here. A 50-year-old patient is discharged from the hospital by Dr. Glass. Uh, he was diagnosed with dementia stage 4, and the 45 minutes was spent discharging the patient from the hospital, and 25 minutes of total time was spent in admitting the patient as well. So which guidelines do you think we are going to use here? Yes, it is going to be the guideline of initial nursing services with hospital discharge guideline, and it states that the hospital inpatient or observation discharge services performed on the same day of the nursing facility admission or readmission are reported separately. So yes, we are going to report both the services, the discharge services from the hospital as well as admitting services in the nursing facility as well. So code both. So from on-site itself, we can eliminate option B because this scenario requires a minimum of 2 codes, right? So we can eliminate option B on site. And okay, before going further into that scenario, I would just want to remind you on the discharge codes which we are having. We are having an hospital inpatient or observation care discharge, which is a hospital inpatient or observation same day admission and same day discharge. And we are having a hospital inpatient or observation discharge services that is coded when the patient is being discharged from the hospital inpatient status. And then we are having a nursing facility discharge services as well, which is given when the patient is discharged from the nursing facility. So these all are the 3 discharge services which we are having, discharge service codes, CPT codes which we are having. Now let's go ahead and solve this one. So patient was discharged in our scenario from the hospital. So we are going to code first the hospital discharge code. And from the scenario, we can see the patient spent, the doctor spent around 45 minutes discharging the patient, and admitting the patient to the nursing facility, doctor spent around 25 minutes. So the correct answer for this one is going to be 99239. That is coding for the discharge services, which is up to 45 minutes. And we are also coding for 99304, and that is going to be for the initial nursing facility care. It's around 25 minutes must be met or exceeded. So the time is met here. So the correct answer, as most of you have said, is going to be option A, 99239 and 99304. So excellent work, coders. So are you ready for one another scenario? And I can see a lot of yes in the chats. So let's do one more scenario here. Mr. Smith, you can take it away as well, this one as well.
Thank you so much, Mr. Sandeep, again. Of the following, which code or codes best describe the encounter? A, 99304, B, 99305, C, 99306, and D, 99223. Mr. Richardson, an 85-year-old with dementia, was admitted into the Riverside Skilled Nursing Facility. The initial visit was carried out by the physician's assistant who performed a medically appropriate history and exam. The patient had multiple morbidities that will require extensive management. In addition to the patient's dementia, he presents with CKD, heart failure, diabetes, and colon cancer. The PA reviewed the specialist note for the patient's nephrologist, cardiologist, endocrinologist, gastroenterologist, and neurologist. The PA also had conference with the 5 specialists to discuss patient management. The patient has multiple stable chronic conditions that will require close monitoring. Of the following, which code or codes best describe this encounter? Coders, you have 2 minutes to solve this scenario. Thank you.
So that's 2 minutes. And once again, thank you, Ms. Jasmine, for reading this one as well for me. So what I see is that some of you are going to have an aha moment on this scenario, and some of you have given a forensic look into this scenario as well. So let's solve this one. So do you think this is a codable one, this particular scenario? Because okay, let's first highlight the keywords. We are having an 85-year-old patient, and the patient was diagnosed with a dementia, and patient was admitted to the Riverside Skilled Nursing Facility, which is very important. Riverside Skilled Nursing Facility, and the physician assistant who performed a medically appropriate history and exam, and an extensive management was also required. The patient's dementia was the patient. In addition to the patient dementia, there was a CKD, heart failure, diabetes, and colon cancer. The physician assistant reviewed the specialist notes for patients, specialist notes from the patient's nephrologist, cardiologist, endocrinologist, and gastroenterologist, along with the neurologist. And the physician assistant also had conferences with the 5 specialists to discuss the patient's management. And if you have a forensic look into these guidelines, Ms. J especially mentioned this before we started the scenario session. It states that for a skilled nursing facility, the initial comprehensive visit must be performed by a physician. So if you look at the scenario, there was no physician here. It was a physician assistant who performed the medically appropriate history exam and all the management here. The discussion with the specialist like nephrologist, cardiologist, endocrinologist, and gastroenterologist and neurologist, everything was performed by the physician assistant. So I don't think this one can be given an E&M service code. So the code for coding the comprehensive nursing facility visits performed by a physician assistant in 2023, it depends upon few factors, including the specific service provided, the payer, and the coding guidelines. So typically, the CPT code for a comprehensive nursing facility performed by a physician assistant would be a 99304, a 99 or a 99305. However, in 2023, the guideline stipulates that only a physician may carry out the comprehensive visits for a skilled nursing facility. So it's important to note that the coding is subject to change, and it is always best to check with the specific payer for the most up-to-date information and to ensure that you are using the correct codes for the services provided. And the law that governs the healthcare in your state as well. So as it stands now, only the physician may carry out these services for skilled nursing facility. And you also have to look that there is no guidance has been provided uh, on the definition of a comprehensive visit in 2023. So this was a teachable moment. So that's all about scenario 4. And let's see what we're having next. So we are going to provide a summary of nursing visit guideline. So the principal, doctor, and the physician, the qualified healthcare professional are the one who's involved in nursing visit services. Admission from another side, especially the ED office, are reported separately using a modified 25 to the other visit. If the E&M service is separate in the separate site and the initial nursing is a consultation, the consultant must report a subsequent nursing codes. If discharged from hospital or observation, then admitted to the nursing facility code 99238 and 99239 with initial nursing visit, and same day admit or discharge, use the discharge code 99234, 99235, 99236. Initial codes may only be used once per admission, and initial comprehensive skilled nursing visits must be performed by a physician. So qualified healthcare professional may only report initial comprehensive if allowed in the state. Initial services by other physician or qualified healthcare professional in the practice carrying out the consultation may use initial visit or consultation codes, and initial visits may be used when the patient has not received any face-to-face services by the practice during that stay. One per practice stay. One practice per stay. So we're having nursing facility section deletion codes as well. The deletion of nursing facility services ENM code 99318. The deletion of nursing facility service ENM codes 99304 to 99310, 99315, 99316, and those guidelines. So deletion of domiciliary, rest home, or custodial care ENM codes 99324 to 99238, 99334 to 99337, 99339, 99340, and deletion of home or residence service ENM code 99343, and revision of home or residence service ENM codes 99341, 99342, 99344, 99345, 99347 to 99350, and guidelines. So that's all from nursing facility section, and I think Ms. J is having a good topic ahead on prolonged visits.
All right. Yes, indeed. Outstanding. Outstanding explanations. Thank you so much, Mr. Sandeep and Miss Jasmeet. Now it's time to switch gears. We're going to turn our attention to prolonged services. And what we're going to do here, we're going to talk about all of the guidelines at once, then we'll solve the scenarios at the end of the discussion. So first, we're going to talk about prolonged services when their E&M encounter is on the day other than a face-to-face encounter. What do you mean, Mrs. J? You could have said that better. Yeah, I probably could have. I could have said something like, when it's a prolonged services that we're coding for, but the E&M encounter, the face-to-face encounter, was on a different day than the prolonged services encounter. Okay, I like that one better. All right, so let's get started with the guidelines for prolonged service on date other than the face-to-face evaluation and management service without direct patient contact. So in other words, that means that the service that the prolonged service that we are coding for is not taking place on the date of the E&M encounter. It's not permitted. In fact, these codes in this series, 99358 and 99359, must be used on date other than the face-to-face E&M service with the patient, family, or caregiver. This encounter must be related to that face-to-face or a face-to-face encounter as part of ongoing patient management. An example is extensive record review. Let's say patient saw doctor on Monday. Let's say on Tuesday, doctor is reviewing their records. So, and that time is prolonged. It's indeed eligible to be coded. Also, codes 99358 and 59 may be used for any E&M service, not just time spent selecting the level of the face-to-face service. So That's good to know. Codes 99358 and 99359 are used to report the total duration of time, and that time or date does not have to be continuous. Also, do not report prolonged service of less than 30 minutes. Code 99358 is used to report the first hour, and it can only be used once per date on any given day. And finally, prolonged services of less than 15 minutes beyond the first hour or less than 15 minutes beyond the final 30 minutes are not reported separately. And finally, if you want to see a different on a different day than the doctor visit, not face to face. So these codes are used for on a different date than the doctor visit, and these codes are not face to face. I think we drove that home. I do. Talk to me. Go ahead and type in the chat. Let me know how you feel. Now we can go ahead and CHUN 99358 and 99359. All right, 99358 is used for the first hour of prolonged services. And remember, it's non-direct contact on date other than face-to-face visit. 99359, this is for each additional 30 minutes. However, that last unit must be 15 minutes or more. So if the last unit isn't quite 30 minutes, it must be 15 minutes or more to use 99359. And below, you've got a nice chart. I'm loving these charts for prolonged services because they will assure you that you're going to code accurately. So my advice, use the charts when you can. All right, so here they are. Now we're going to turn our attention to another type of prolonged services, and this type is for the supervised clinical team. So it's the clinical team, the nurses, the technicians, etc., in the office who are supervised by the physician or the qualified healthcare professional. And these are the guidelines. Prolonged clinical staff codes are used for E&M services provided in the office or outpatient setting with prolonged clinical staff face-to-face time with the patient and or family or caregiver. So they are in the office, it's face-to-face time. Also, you must report these codes in addition to the E&M service at the same session. Number 3, you have to report the total duration of the face-to-face time with the patient and or family caregiver by that clinical team member. 4, these codes can only be used for no more than 2 simultaneous patients. So you can't be working with 3 patients, no more than 2. And I didn't say what the codes were, but they are 99415 and 99416. Also, these codes can only be used for the time devoted to a single patient. So if you're working on 2 patients, your clinician that you're coding for is working on 2 patients, you can only use the time that clinician used for that single patient. So if they combine the time, that's not going to be permitted. Also, do not use code for 99415 if time is less than 30 minutes. Time spent performing separate services, it does not count towards the prolonged services time. And I also want to draw your attention to what's the language in the purple box. It says code 99416 is used to report each additional 30 minutes of prolonged clinical staff service beyond the first hour. Code 99416 may also be used to report the final 15 to 30 minutes of prolonged service on a given date, and prolonged service of less than 15 minutes beyond the first hour or less than 15 minutes beyond the final 30 minutes is not reported. Okay, we will show you, we'll give you a visual of that, but let's move on and let's CHUN this section. All right, codes 99415, 99416 may be reported for no more than 2 simultaneous patients. Remember that, okay? And the prolonged services by the physician or other qualified healthcare professional on the date of an office or other outpatient evaluation and management service. So these codes are used in conjunction with an office visit in the office. And look, 99415, that's an add-on code, right? Pay attention to that. So if it's an add-on code, you know you don't code those by themselves. They have to be coded in addition to another encounter. And that encounter is an office visit. And 99415 is coded for the first hour. 99416 is coded for each additional 30 minutes. And that last unit must be 15 minutes or more to use 99416. Now, some people at the onset of these sessions were saying, hey, I really want to get to prolonged services. That's, it's really, really something I want to talk about. Okay, I understand. And I think this section right down here might be why, one of the reasons why, because it says the starting point for 99415 is 30 minutes beyond the typical clinical staff time for ongoing assessment of the patient during the office visit. What does that mean? I'm going to show you. The reporting prolonged clinical staff timetables provide the typical clinical staff times for the office or other outpatient primary codes, the range of time beyond the clinical staff for which 99415 may be reported, and the starting point at which 99416 may be reported. Okay, what is that? Well, that means that we need to know the typical clinical staff time, and you cannot code directly from the code series. You can't code directly from here because you'll need to know what the typical clinical staff time is if it's not indicated in your documentation. What does that mean? That means that there's a chart for 99415, right? And the guideline up at the top says the starting point for 99415 is 30 minutes beyond the typical, let's go back, typical clinical staff time. All right, so essentially, these codes, these clinical team codes are coded in addition to the office visit. In fact, they are driven off of the office visit. All right. So the starting point for 99415 is 30 minutes beyond the typical clinical staff time. So that means that these codes are driven off of the doctor or the qualified healthcare practitioner visit code, right? We have no way of knowing what the typical clinical time is unless we look at this chart. So if a doctor says or if a doctor encounter comes up 99202, you will use only this information to determine the typical clinical staff time. So for 99202, the typical clinical staff time is between 29 up to 58 minutes. So up to 58 minutes is the typical clinical staff time, and anything beyond that is prolonged time. So for 99202, prolonged time for that clinical team is 59 minutes up to 103 minutes. And then you can use 99415. Beyond 103 minutes, 104, you can use 99416. All right, I'm going to let that marinate. And then I'm going to switch gears and we're going to talk about prolonged services with and without face-to-face visits on the same day as a visit. All right, so when there's a doctor visit, and anytime the doctor has prolonged time, you use these codes. And those codes are 99417 and 99418. And here are the guidelines. 99417 is used to report the prolonged time spent by a doctor or qualified healthcare professional on that date of service, and it's in the outpatient. All right, and the visits include office visits, outpatient visits, including consultations, home visits, and cognitive assessments in the home or office. Now, the difference between 99417 and 99418. 99418 is used to report prolonged time provided by a physician or QHP on the date of inpatient evaluation and management, same day admit and discharge services, inpatient consultations, nursing facility visits, anything inpatient. I think we have some more guidelines. Let's look. And you may only report these codes if time is documented for the encounter. You report 99417 and 418 after 15 minutes has been exceeded, and do not report 99417 and 99418 with 99358, 59. Those are the other prolonged services codes, and don't report these codes with 99415 and 416. Okay. Now it's time to go ahead and CHUN the prolonged doctor visit codes. Okay, doctor or other outpatient or office visits codes. 99417 is used for outpatient, office, home consults, and cognitive assessments. And each 15 minutes of total time. And these are the code series that you can use this code with. I thought I would CHUN that. And not to be used for units of time less than 15 minutes. 99418. Oh, also, do not use these codes with psychotherapy codes, non-direct prolonged services codes, and prolonged clinical team services. Okay, so don't use it with the other prolonged services codes, and don't use it with psychotherapy codes. Also, now we're turning our attention to inpatient. 99418. Use these for hospital, inpatient, or observation. Use them for consults and same day admission and discharge on the same date. All right, we have 15 minutes of total time for this code. Use it for each 15 minutes. Use them for inpatient, hospital, inpatient or observation, same day, consults, and nursing facility visits. Sorry, I forgot that. Make sure you put nursing facility visit right underneath your 99418. And don't use these for psychotherapy. And don't use these for non-direct, that means non-face-to-face prolonged services codes. And these are not to be used for units of time less than 15 minutes. I'm not finished. All right, so I got to show you a chart. Let's go ahead and chun the chart. All right, so this chart is for the office and outpatient services. There is no chart for inpatient. So just make sure that you understand that the top part is for new patients, the middle is for established patients, and the bottom is for outpatient consultations. And now I want to complete my review of the guidelines by, I made this little chart for you. Maybe it'll work for you, maybe it won't, but prolonged services, no patient contact, no face-to-face patient contact on the date of service. So you do not use these codes when the patient has had a face-to-face service. And you don't use it on the date. All right. And these are used by doctors and QHPs only. The clinical staff, theirs is used, their codes are only for the clinical team only. These are not doctor codes. And the prolonged service with or without direct patient contact on the same date as an E&M service, these are used by doctors and QHPs only. So you understand that. And then I gave you some main points. For 99358, 99359, one thing I want to point out, 99358 is not an add-on code and it stands alone. So let that be your cue that this code stands alone and doesn't need a doctor visit, doesn't need an office visit. It stands alone. And these codes are used on dates other than that office visit. And the points are these codes are without direct face-to-face. They're used only once per day on a date other than the face-to-face. And these must be related to that face-to-face, but not used on the same date. The clinical team, these are used with face-to-face encounters with the doctor, and you report in addition to the E&M service at the same session. Also, 99417, these are used with or without outpatient, with or without face-to-face in the outpatient office, home consultations, and cognitive assessments. And 99418, this is direct or non-direct inpatient consultations, same day, admit discharge visits, and nursing. So it will make sense with practice. And on that note, are you ready to test your knowledge? All right, so before you do, I just want to bring or remind you about the approved provider time-based activities. These activities are what the provider should be doing when time is being used to determine the level of service. And the reason I'm saying this is because a lot, or if not all, of the prolonged services are time-based. Yeah. So, kind of remember some of the things that the provider can be doing. They can prepare to see the patient. They can obtain and or review separately obtained history. They can perform a medically appropriate exam or evaluation. They can counsel and educate the patient, family, caregiver. They can order medications or procedures. They can refer and communicate with other healthcare professionals. They can document clinical information in the EMR. They can independently interpret results that are not separately reportable and communicating results to the patient, family, and caregiver. And care coordination. Now, I do want to remind you, these are for doctors and QHPs, not the clinical staff supervised by physicians and QHPs. Their services are different and they are defined. Also, you're still going to have to use your keywords. I'm not going to review that. Here's what I found. And finally, what we're looking for whenever we're selecting the level of service. This will come into play as well. You'll need to know, answer the question, is it a history or exam? What is the location of the visit? Not the physical location all the time, but the location in the manual. The type of visit, is it new, initial, established, or subsequent? What is the total time of the visit? This is going to be huge. Also, medical decision making. And finally, no, not finally, the E&M tables, go ahead and use them. And finally, don't forget to apply all guidelines. All right. Without further ado, let's get started solving our first scenario. And I'm going to ask Miss Tamika to come to the fore, please, and thank you.
My pleasure, Mrs. J. All right, coders, let's dig into our next scenario. Of the following, which code best describes the encounter? Is it A, 99213, B, 99213, 99358, C, 99358, 99359, and finally D, 99238? A physician is conducting a review of medical records today for a patient who was seen in their office the previous week for a follow-up appointment. Although the previous visit was a low MDM visit, the physician spends 1 hour and 15 minutes reviewing the patient's records, making notes, and documenting the patient's treatment plan. Because the patient seems to have an underlying autoimmunity disorder associated with the patient's thyroid, the doctor will consult with an endocrinologist for diagnosis confirmation. Again, of the following, which code best describes the above encounter? You have 2 minutes, coders, and your time, it begins now.
Time's up. Did you like that clock? I'll tell you, I love that clock. Thank you so much, Miss Tamika. Miss Tamika also designed that clock too. So thank you. All right, so let's get into it and highlight our keywords. First of all, let me ask you, how are you? Are you feeling okay with this so far? How did you feel doing this scenario? This is our first prolonged services. Go ahead, type in the chat. Let me know. Okay, so here are the keywords. Review medical records. The patient was seen in the office the previous week. Then doctor spends an hour and 15 minutes reviewing the patient records. Now I made it pink because it's not really codable, but it's pertinent. So this is what the patient's doing, um, making notes, documenting the patient's treatment plan, because that doctor felt something was wrong. So he went in on a different date and did some work. All right, so the doctor feels that this patient may have an autoimmunity disorder involving the thyroid. So this doctor spent an hour and 15 minutes. So can you eliminate anything on site? Go ahead, type your answers in the chat. All right. So I have another question. Is this a prolonged services visit or encounter? We're not going to say visit, encounter. Absolutely, it is. It is a prolonged services encounter because it is time beyond the typical time. However, in this case, this is a specific visit. So, what type of prolonged service visit is this? All right, so if you said this is a non face to face, I would say on the day other than the E&M visit. So it's a non face to face encounter. I don't like that word visit, so I'm going to try and take it out. I don't know if you will see it or not, but it's a non face to face encounter on the day other than the E&M visit, right? Oh, yeah, I think it's taking it out. There you go. And with that said, can you eliminate anything on site? Absolutely. You can eliminate A because they're coding for the office visit. This is the E&M visit. And they're also coding for it as well at B. So you can eliminate the two. And the guidelines say that you cannot code not the office visit with 99235 and 39. You cannot. So A and B gotta go. Yeah, we're going to eliminate all doctor visits because they can't occur with that prolonged services code series 99358 and 99359. And speaking of, I love referencing the guidelines. So just to help me recall the guidelines for 99358 and 9, you have to use these codes, or you may only use these codes on a date other than the face-to-face E&M service. Also, these codes must be related to a face-to-face or non-face-to-face E&M encounter. They have to be related, but it cannot be on the same day. And these codes, 99358 and 9, are used to report the total duration of non-face-to-face time spent by a physician. And down below, there are your do nots. Don't code these two codes with below. So that's enough for me. That's enough. I think we can do it. All right. So we've eliminated A and B because it violates the rule of coding on the same day as an office visit. And here are my two codes. 99358 is coded for the first hour, and we are coding for 1 hour and 15 minutes. And although 99359 is coding for the second hour or the second 30 minutes, We can code it, and here's why. Now, if you try to do this on your own, you might say, well, I can't code the 99359. Yes, you can. And see this chart below? It's going to help us. First thing that we need to do, break everything down into minutes. And 1 hour and 15 minutes equals 75 minutes. Now let's look for 75 minutes on the chart below. There you go. 75 to 104 minutes says that you can code 1 unit of 99358 and 1 unit of 99359. So we see that C is correct. But for those of you that say, well, how can you code 99359? It says each additional 30 minutes. Well, the guidelines also say that the final unit must be a minimum of 15 minutes to use 99359, and the difference between and that's what we had remaining. So the first hour was 60 minutes, and we had 15 minutes remaining. So we can use 99359 because the final unit was a minimum of 15 minutes. All right, take it away, please, and thank you.
My pleasure, Mrs. J. All right, coders. I know you guys are ready. You all are digging in, and we appreciate your participation. So here we go with scenario 7. Of the following, which code best describes the encounter? Is it A, 99214, 99415, B, 99214, 99415, or 99416? C, 99214, and finally D, 99415, 99416. Dr. Stein, a primary care physician, sees a 55-year-old patient with chronic obstructive pulmonary disease in the office for a routine follow-up visit. The physician carries out a moderate exam with moderate MDM. The physician determines that the patient needs pulmonary function testing to evaluate their COPD. The physician orders the PFT, and a licensed practical nurse performs the test under the supervision of the physician. The LPN performs the PFT and notes the results in the patient's chart. However, the patient had some difficulty during the test, and so the nurse spent an additional 95 minutes beyond the typical time with the patient. Again, of the following, which code best describes the above encounter? All right, coders, you have 2 minutes and the tick of the talk. It begins now.
All right, I apologize for the additional time. I did not see that clock. All right, so let's do our due diligence. We have a 55-year-old patient. We have a disease of COPD. The physician carried out a moderate exam with moderate MDM. Then the patient needed a pulmonary function test, and the physician asked the nurse to carry it out, the LPN, excuse me. So the LPN spent an additional 95 minutes beyond her typical time with the patient. That's important. And you're going to see why that language is important. All right. So let's do our well, can you eliminate anything on site based on what you know or what we've reviewed in terms of guidelines? Well, I think we can eliminate C99214 because that's only coding for the physician. It is not coding for the clinical team supervised by the physician. And I'm pretty sure she's entitled to prolonged services. So the guideline says that her or his services are reported in addition to the doctor's, right? So C is not even coding for hers, and therefore we can eliminate C. We can also eliminate something else, right? Look at D. Yeah, we can eliminate that too. Those are add-on codes. We can get rid of them, and those are just only coding for the clinical team. Just saying. All right, so let's get going. So if we use the codes, we can get the answer, right? We're coding for 95 minutes beyond the typical time spent with a patient. So if the first hour is for the first 60 minutes, and the remainder, we have 35 minutes remaining, we can code 99416. And remember, we have to code it in addition to the doctor visit, right? So we're going to eliminate A because it's not coding for 99416, and we cannot code that additional 5 minutes because the last unit must be 15 minutes or more to use 99416. All right. So B is the correct answer. How did you do? All right. Miss Tamika, we have another scenario. Please and thank you.
My pleasure, Mrs. J. All right, coders, we are continuing on with scenario 8. Of the following, which code best describes the encounter for Dr. Bruce? Is it A, 99214, 99215, 99416 times 2, B, 99415, 99214, C, 99214, D, 99214, 99415, 99416? Mr. Allen, a 60-year-old who has the history of hypertension and type 2 diabetes, was visiting his endocrinologist, Dr. Bruce, today. The RN of the practice works with the two physicians. While working with Dr. Gary, the other doctor in the practice, and another patient, the nurse was asked to also work with Dr. Bruce because the nurse has an extensive background in the management of chronic illnesses. While Dr. Bruce carried out a comprehensive review of Mr. Allen's medical history and physical examination, he rendered a moderate MDM. During the time of Mr. Allen's evaluation, the nurse aided Dr. Gary with a PFT study. When finished, she returned to assist Dr. Bruce by providing education and support to help Mr. Allen manage his diabetes and hypertension. The nurse also developed a comprehensive individualized care plan for daily management of the patient's chronic conditions to achieve an optimal quality of life. The RN is claiming 120 minutes of total time with Dr. Bruce. Again, of the following, which codes best describe the encounter for Dr. Bruce? All right, coders, just take it in, think about it. Your time of 2 minutes, it begins right now.
All righty. I love that clock. I just want to tell you, I love it so much. Thank you, Miss Tamika. All right, our keywords. This was a big one, right? This is a 60-year-old, hypertension, type 2 diabetes, with Dr. Bruce today, visiting his endocrinologist. And the RN of the practice works with two physicians, Dr. Bruce and Dr. Gary. Mr. Allen, Dr. Bruce carried out a physical examination with Mr. Allen with a moderate MDM. And the nurse also aided Dr. Gary at the same time. But the nurse returned to Dr. Bruce and helped the patient by developing a comprehensive individualized care plan for daily management. And the nurse is claiming 120 minutes of total time with Dr. Bruce. So if you're wondering, why is Mrs. J talking like that? I'm talking like that because I want to tell you something. I'm telling you that the nurse is claiming 120 minutes of total time, and by golly, we need typical time. Yeah, we need to know her typical time. I don't know what her typical time is. So let's go ahead and go to the guidelines. There's a couple of things going on. Can she work with these two doctors simultaneously? Well, in the guidelines, it says codes 99415, 99416 may be reported for no more than two simultaneous patients, and the time reported is the time devoted only to a single patient. All right, that's fair enough. So the guidelines say She can work with both doctors, but she must only report the time for that one patient. And this RN is claiming 120 minutes of total time with Dr. Bruce. So I think that's fair. So let's go ahead and code this out, right? I don't know. All right, so if you look at 99415 and 99416, 99415 is coding for the first hour, and 99416 is coding for each additional 30 minutes. So we have 60 minutes to code. So that should be 2 units, right? Yeah, that should be 2 units. Okay. Um, on site, can we eliminate anything before I get into this discussion? If you say B, absolutely, because they're coding 99415 before 99214. 99415, as you can see, is an add-on code. And remember, they're never sequenced first. So we can get rid of B. Anything else? I don't think so. I don't know. But remember I said something about typical clinical staff time? The guideline is right underneath. It says the starting point for 99415 is 30 minutes beyond the typical clinical staff time. We don't know what the typical clinical staff time is because we need the chart to determine it, right? The RN is just claiming for 120 minutes of total time, but we need to know that typical clinical staff time so that we know we have to go over it by 30 minutes. So here is the typical time chart. And remember, our doctor had a moderate visit. Pardon me. It was a moderate encounter. So 99214 is it. Let's go down. Excuse me. All right, so let's go down. And locate our typical clinical staff time. This is the typical time chart for the clinical staff. So let's find the provider's code. It's based off of the doctor or QHP's encounter code. And our encounter is 99214. If you go down, 99214 is right here. And the typical clinical staff time is no more than 69 minutes, from 40 to 69 minutes. And 30 minutes over that begins your time for prolonged services. So our time is 120 minutes. We've already established we can use 99415 because we've exceeded 114 minutes. So let's see if we can use any other. Yes, we are 120 minutes. So yeah, we're falling in this box. So we can code both 99415 and 99416. So again, I'll repeat it. It's based off of the doctor's encounter. You have to score the doctor or level or determine the doctor's level of service. We've determined it to be 99214 for a moderate established patient. And the typical clinical staff time gets no code because this is the typical time that the clinical team would work or that RN would be working. If she goes over 69 minutes, which is 30 minutes beyond the typical time, 30 minutes, right? If she goes to 70, then she's entitled to code for prolonged services. But she didn't just go over to 70. She went 120 minutes. So let's see where that is. That falls over here. She can use both. All right. So here's the clinical staff time, the typical clinical staff time based off the doctor visit. we have 120 minutes to code for. We can code for the 99415 and 99416. So 1 unit of 99416, because only 5 minutes remain. What do you mean, Mrs. J? Take a look. All right, so we know we can code 1 unit of 99415 and only 1 unit of 99416, because we have 5 minutes remaining, right? Yeah, it only goes up to 115. 5 minutes remaining. And we can't code that additional because the last unit must be 15 or more. So the answer is 99214 and 99416. And the answer is D. And you know what? Sorry about that. It doesn't say that. Hmm. I wanted to say it. Come on. I want the correct answer up here. All right, I'm gonna go back. But while we're letting that get adjusted right there, I know some of you are like, what did Mrs. J just do? Well, I tried to show you that you cannot code from the code series without knowing the typical time. So if the documentation specifies that time over, then you can go ahead and code it from the code series, right from the codes with the code language. However, if they don't, you're going to have to use the typical time chart. And if you didn't understand that, I have a visual for you. All right, so for 99214 at the top, that is the doctor's code. Everything is based off the doctor's visit. The nurse's typical work time is between 40 and 69 minutes. That's what she doesn't get paid additionally. This is not considered prolonged services. It becomes prolonged services the moment she gets to 70 minutes. This begins her prolonged time. And no matter what she's doing, if she's going from patient to patient, her prolonged time begins, but only the time documented for her patient. And up into 114 minutes, you can code 99415. And then beyond that 114 minutes, 115 minutes, you can go ahead and code 99416. So in our case, she is claiming 120 minutes. So that means that we have 5 minutes remaining and we cannot code anything more. We can't use another unit of 99416 unless it's 15 minutes. It has to at least be 15 minutes. And then I'm just going to be quiet. I want to be quiet because I want that to marinate. All right. Okay, so hopefully you got that. All right, Miss Tamika, please and thank you.
My pleasure, Mrs. J. All right, coders, I don't know about you, but I'm letting that marinate. We got a lot of pots on the stove, a lot of good information that's just simmering. So here we go with scenario 9. The physician spent a total of 120 minutes during the encounter. Of the following, which best describes the above encounter? We have A, 99205, B, 99205, 99417, C, 99245, 99417, 99418, and finally D, 99205, 99417 times 4. Miss Donaldson is an 85-year-old female who's been experiencing memory loss and confusion for several months. Her family noticed a decline in her daily functioning and were referred to Dr. Smith, a neurologist, for evaluation and management of her condition. During her visit, the provider conducted a comprehensive medical history and physical examination, paying close attention to her neurological function and cognitive abilities. The examination was accompanied by a high MDM. Then Dr. Smith diagnosed Ms. Donaldson with dementia and wrote a prescription for donepezil to improve her cognitive function. Dr. Smith spent time talking to Ms. Donaldson and her family about her diagnosis, the progression of the disease, and the available treatment options. The importance of maintaining a healthy lifestyle, including a balanced diet, regular exercise, and social engagement, were emphasized to slow down the progression of the disease. The physician spent a total of 120 minutes during the encounter. Again, of the following, which best describes the above encounter? All right, coders, you have 120 seconds. And we're going to say 2 minutes. Same thing, right? So the tick of the clock, it begins now, coders. Here we go.
All right. How did you do? And I apologize for my on clicks. I don't know if it's the webinar or not, but it's 85-year-old memory loss, confusion. Neurologist carried out, Dr. Smith, a urologist, carried out a comprehensive medical history and exam, paying attention to her neurological function. All right, so this was a high MDM, and Dr. Smith diagnosed the patient with dementia. Dr. Smith spent time talking to Mrs. Donaldson and family, and this was a total of 120 minutes. And yes, a prescription was written. All right, so I got some questions for you. Let's go ahead and let's answer the questions, because we haven't done that. So go ahead and let's answer. Did a history and or exam take place? Was it carried out? Yeah, there was an examination. Yeah, it was medically appropriate. So we're going to say yes. What about the location of the visit? Where is the visit? And I'm not talking about where they are. Where in the book? All right. So is this a consultation? I don't think so, because her family requested this, right? So the family referred her to Dr. Smith. So this is not a consultation. This is an office visit. And if the family requested it, and we're going to get rid of C, because we know, because we've been doing this for a little while, that 99245 is not an office visit. In fact, it's a consultation, an office consultation. Now, this is a new visit because the family recommended the patient to Dr. Smith. That means the patient has never seen Dr. Smith before, and the total time is 120 minutes. All right, so I think we got enough. Yeah, so let's try it. We're going to go and get the chart. We have 120 minutes. And remember, this is an office visit, so we can use the office visit chart. And if you want to follow along, go ahead, turn to your prolonged services chart for office visits. It's somewhere around page 30, somewhere around there, but it's under prolonged services for, with and without face-to-face on the same day of the encounter with the patient. Okay. All right, so we have 120 minutes, so I'm going to find the correct section on this chart. This is a new patient, right? And if we look down, we look for 120. Well, we have 105, so let's go ahead and start with that. And it gives us 99205 and 99417 times 3 or more for each additional 15 minutes. So let me go ahead. Let's go ahead and document. We've got 15 minutes remaining. So if we document 120 minus 105 minutes, that leaves us with 15 minutes. So we know we can code 99205, at least that, and 99417 3 times. We know we can do that. So we need to go to our chart to see if we can code those additional 15 minutes. And also, we're going to eliminate A because they aren't coding for any prolonged service office visits. Also, too, look at C. C's coding for the office visit, the prolonged office visit, and the prolonged inpatient visit as well. All right, so I like 99417. I do. And also, we need to code for those 15 minutes remaining. Can we? Yes, we can. Right here it says, not to be used for units of time less than 15 minutes. So we can code that additional unit, that 99417, one more time, and D is our answer. 99205, 99417 times 4. All right, so we've got one more scenario, and we're going to make this one a good one. Miss Tamika, please and thank you.
My pleasure, Mrs. J. All right, coders, let's lean into this final scenario. I know you've got it in you, all right? So let's get started. Of the following, which best describes the consultant? Is it A, 99255, 99418 times 2, B, 99205, 99418, B, 99245, 99417, 99418, or finally D, 99255, 99417, 99418. A 55-year-old female was admitted after a radical mastectomy with invasive ductal carcinoma of the right breast. Tram reconstruction could not be performed because intraoperative pathological results came back positive for malignancies in the lower abdominal tissue. Because the pathologist could not confirm the origins, the oncologist requested a consultation with Dr. Myers, an OBGYN, to rule out malignancies of the female genital system. Dr. Myers carried out a comprehensive medical history and conducted a thorough gynecological physical examination, paying special attention to the vagina, uterus, cervix, and ovaries. The consultant ordered a CT scan, ultrasound, MRI, and PET scan, read the results, and then recommended the patient have a colposcopy with biopsy before offering a confirmatory diagnosis. The encounter produced a high MDM. The consultant spent a total of 120 minutes of total time in the encounter with the patient and family, who had several questions about the patient's outlook in terms of breast cancer and probable cancer of the female genital system. The consultant reported his findings via written correspondence back to the patient's oncologist. Again, I ask you, coders, of the following, which best describes the consultant? Just take a breath, take it in, and the tick of the clock, it begins now. You have 2 minutes, coders.
All right. This was a big one. All right, so we have a 55-year-old admitted after radical mastectomy. OBGYN, a consultation with Dr. Myers for OBGYN to rule out malignancies. I think my unclicks are off, but it's okay. Her pathological results came back positive for malignancies, and the oncologist requested that consultation. The consultant ordered a CT scan, ultrasound, MRI, and PET scan, and wanted a colposcopy before providing a confirmatory diagnosis. 120 minutes of total time, and the consultant reported his findings back to the his findings, his written correspondence back to the oncologist, and that's important. All right, so coders, is this a consultation? I knew you knew it was. Yes, it was. It's a consultation because we had a request. The oncologist requested the consultant carried out some things, rendered some service, didn't render a diagnosis, but did render treatment and services. And they wrote back, the consultant wrote back to the doctor. So yes, this is a consultation. The 3 R's were met. Now, what type of consultation is this? Well, I'm giving you a hint. Yes, it's an inpatient consultation because the patient was admitted after a radical mastectomy, and there's no mention that she discharged. All right, so if this is inpatient, if you look at the codes, we've been dealing with 992 code series all night, all day, and 99205 gotta go. This is not an office visit. All right. Let's solve this. So we have time. We have 100 minutes of total time. I'm going to the CPT manual and I'm going to pull out the inpatient or observation consultants chart. And for 120 minutes of total time, you must have a medically appropriate history and or exam, and that did take place. Dr. Myers carried out a comprehensive medical history and exam, and yes, we're going to look for the total time. And on site, C is eliminated as well because we're not coding for outpatient prolonged services 99417. So let's get back to it. We're going to look at our chart. We're going to go as high as we can go. 80 minutes is it. And 80 minutes produces 99255. So that is our office visit code. Anything beyond 80 minutes is prolonged services. So we can go right to our codes, right? Let's go to the codes. And we're going to only look at 99418. Right? Because that's for inpatient, right? So we have to code for 40 prolonged units. And 99418 codes for 15 minutes. We need 40 minutes, okay? And if you can't figure it out, some people can't. Sometimes I can't. So we're going to use this circle that's divided into fourths to emphasize a unit of 15 minutes. So the first quadrant is 15 minutes. The second is quadrant is 15 minutes, so that's 30 units. And then we have 10 minutes remaining. And if we have 10 minutes remaining, can we code that? No, it says not to be used for units of time less than 15 minutes. So we can code 2 units of 99418 along with 99225. And A is our answer. All right, so hopefully you got that. I'm pretty sure you did. All right, so let's go ahead. And if you did, outstanding. If you learned something, and I think a lot of you learned something before I exit out, I know a lot of you learned something, and that is priceless. And remember, this will be available in playback. You can watch this as many times as you need. Just remember that there are 3 different types of prolonged services that you'll be coding for. 99358, that's not an add-on code, and 99359 is, but these 2 are for non-face-to-face contact with the patient, and it's not on the date of the visit. Your clinical team, they have their codes 99415, 99416, and these are used in addition to the doctor visit, and these are coded on the date of the visit. And finally, 99417, 99418, these are used on the date of the visit, and these are used by your doctor and QHP. Now let's quickly review the guidelines that we pulled out for prolonged services, non-face-to-face encounters. Where's my number 1? I had a 1 here. Okay. They must be used on the date other than the face-to-face E&M service with patient, family, or caregiver. They must be related to a face-to-face encounter as part of an ongoing patient management. An example is extensive record overview. May be used for any E&M service, not just time spent selecting the level of face-to-face service. Codes 99358 and 9 are used to report the total duration of time and date of time, does not have to be continuous. Number 5, do not report prolonged service of less than 30 minutes with 99358. Number 6, code 99358 is used to report for the first hour, and it can only be used once per day on any given day. And 7, prolonged services of less than 15 minutes beyond the first hour or less than 15 minutes beyond the final 30 minutes are not reported separately. Prolonged service for the clinical team supervised by the doctor or QHP. Prolonged clinical staff codes are used for E&M services provided in the office or outpatient setting. And clinical face-to-face time with the patient, family, or caregiver must have taken place. Number 2, these codes are reported in addition to the E&M service at the same session. Number 3, they're reported the total duration of face-to-face time with the patient and or family caregiver by clinical staff. 4, can only be used for no more than 2 simultaneous patients. Number 5, can only be used for time devoted to a single patient. Number 6, do not use code 99415 if the time is less than 30 minutes. And 7, time spent performing separate services does not count toward the prolonged services time. And finally, the codes that we're most often probably going to see: prolonged with or without face-to-face on the same day as the E&M encounter. 99417 and 99418. Remember, they are add-on codes. 99417 is used to report the prolonged time spent by the doctor or QHP on the date of an outpatient visit, including office, consultations, home visits, and cognitive assessments in the home or office visits. Code 99418 is used to report prolonged service time provided by a physician or other qualified healthcare professional on the date of an inpatient evaluation and management services, same day AD consultation, nursing visits. And number 3, may only report these codes if time is documented for the encounter. Number 4, report 9941718 after 15 minutes has been exhausted. And 5, do not, or exceeded. I apologize for saying exhausted. Number 5, do not report 99417 and 99418 with 9935859 or 99415 and 99416. Those are also prolonged services codes, but that will help you to eliminate some wrong answers. It really will. Now, here are the prolonged service code deletions. 99354, 99357 have been deleted, and 99358, 59, 45, and 46 have been heavily revised, heavily. So definitely watch this playback. Hopefully it gives you some guidance. 99417 was revised. And 99418, that's a brand new code with brand new guidelines.